you can either be the mediocre of the elite people or you can be the elite of mediocre people. That's a decision that you have to make. It's not easy for everybody to reach out to everybody. So you guys have different type of people who have completed their journey or still are in their journey. Like I am doing USMLE. I do not need to listen to what a guy of Indian or Australian or England guy says. This is very important that there is a one platform which makes it concise for every aspirant of different exams.
So how should a student think realistically about this path?
You would need a minimum of 20 lakhs to pursue USMLE. Another thing is you have to build your resume towards one or two subjects. So you start early and then you have to build your resume tailor-made to that very specific subject. I know that a lot of people say that not wanting to fail is also an important thing. Like Shah Rukh Khan also says that he acts because he's afraid of failure. But I again feel the fact that if you're not enjoying something, then something has to be changed, either inside you or outside you.
So not every medical journey begins with confidence or clarity. Some begin with a comparison, fear, and the quiet belief that maybe you are not the smartest person in the room. Today's story is about growing inside that discomfort, about being surrounded by brilliance and choosing not to step back but to step up, about friendships, relationships, and support systems that carry you through the uncertainty, about fear of exams, of starting off late, of believing that some paths are meant only for exceptional people. This conversation explores what happens when you stop chasing what looks impressive and start choosing what actually aligns with you are as a doctor and as a human being. Today we have Dr. Chetanya, from MBBS to USMLE, from self-doubt to family medicine. And this is a story of honest effort, late courage, and finding peace in the right place. So let's begin. So hello, Dr. Chetanya. Thanks for joining us.
Hello, sir. Thank you for giving me the opportunity to be here. And it feels very nice to be able to share my journey with everyone.
Yeah. So let's talk about your MBBS journey first. When you entered the MBBS in 2018, you said you weren't the brightest student and felt overwhelmed by the others.
So, sir, this happened because I had not scored very high in NEET UG. So when I compared myself with everyone else, so I thought that maybe I'm not just meant for this place and it's just a fluke that I'm here. And or maybe it's just luck that I'm here. So I had to work hard, but I always felt that maybe I will struggle to keep up with them here academically. But surprisingly, I realized that hard work was needed for majority of the people. And yes, there were very talented people around me, but not everybody was so talented. Majority of the people relied on hard work. And if I am able to work hard, then I can do that. And I had a background of bodybuilding and weightlifting, which had already taught me on how to go to the gym on your bad days. So that translated into studies as well, as surprisingly as it sounds. But it is all about hard work and consistency. And of course, you need a tiny bit of luck. You cannot deny that. But if you're not super talented, you can still succeed.
So what does that feeling of everyone is smarter than me do to a student internally?
So when you have that feeling initially, it makes you question that, are you capable of doing any kind of journey with these people or not? Or you should just stay in mediocre people and continue doing that. But then you have to take a decision that you can either be the mediocre of the elite people or you can be the elite of mediocre people. So that's a decision that you have to make. And I would always say that be a small fish in a big ocean than be a big fish in a small pond.
Okay. So you also said key competition pushed you to become a better. At what point did intimidation turn into motivation?
So, sir, I had this moment in my second year where some person somebody told me that you are not going to be an MBBS doctor. You are rather going to not make it big simply because you're not capable enough. So at that point, initially it was heartbreaking, but then at that point, I realized that maybe I have to prove this guy wrong. I realized that that approach was wrong when you set yourself out to prove somebody else wrong. But I think sometimes it's necessary that you have a target in your mind, and if that gives you the push to do it, it's better than to actually accept what somebody else is saying for you that, okay, you can't do it. So you just accept, okay, I can't do it. And then you quit altogether.
Okay. So you were lucky to find a strong friendship early on. How important is having the right people in the medical college?
Sir, I think having the right people, regardless of medical college, is very important. But in medical college or medical school, it is specifically very, very important because the journey is like 5.5 to 6 years. And the studying pressure is so much that you have constant exams, constant vivas, and not every exam or not every viva is going to go right, and you will have criticism from your professors, criticism from people who you thought were your friends, but actually they were not your friends, they were just colleagues. And so if you have the right kind of people, they can help you push yourself on the days where you don't want to do anything, or on the days where you don't want to put in the work. And sometimes it's okay to not put in the work. Sometimes it's okay to chill, go out and party, have fun with your friends or your partner. But at the same time, having the right set of people is very important for your mental health as well as your career, because they are the ones who are going to shape you. And specifically, I lived in a hostel, so I was not living with my family. So at that time, friends become your family even more. So having those friends is very important. And I was lucky enough to have a lot of them.
Yeah, nowadays, if you'll talk about the students, those who are joining the medicine, they from the day one they start preparing for the post graduation or other competitive exams. So, according to you, what will be your advice to them?
Sir, according to me, the advice for the first year students is to actually just fall in love with the MBBS itself. The first year is very important to form your basics. I'm not saying that if you waste your first year, you are useless. No, that's not true. But the foundation of second year is laid in the first year. So at least you should be thorough with physiology enough. I understand you might not be very excellent in anatomy and biochemistry, but still physiology is something that every medical should focus on, because physiology is never going to leave you no matter what you choose. Even if you specialize, you can choose, like suppose if somebody is an ENT surgeon, okay, they don't need to know the anatomy of the rest of the body except the ear, nose and throat and maybe head and skull. However, um, physiology is never going to leave you, because physiological processes affect every single thing in the body. So it's very important to fall in love with the subject. Don't focus much on PG. Focus on forming good bonds and friendships. Enjoy a lot, because after first year, everything starts to go tougher in life. Because as soon as you advance, the things you look in the past were always easier. But in the first year, don't get overwhelmed by the fact that okay, now it's an MBBS. Just study, work hard, and play hard. Focus
Okay,
on
then,
PG from your second year. Yeah.
yeah. So most of us, when we enter our MBBS, will get new people to get interact with that, and the most people don't want to talk about this. Like they fell in love with someone, yeah, they start their relationships. So if you talk about your MBBS life, like your relationship started in 2019, as you joined MBBS in 2018.
Yes,
So
sir.
and went through ups and downs. So how difficult is to balance personal relationships with the medical training?
Sir, I think personal relationships are very necessary, but I would also say that I'm thankful to God that I was able to find a person who was not a dramatic person. Rather, I'm a more dramatic person. But uh, I was lucky enough to find genuinely a good person, and she handled the worst of me, and she always believed in me. But I would always say that finding a relationship, I'm not saying that it is the most important thing in your MBBS, but I think it would play a very crucial role, because you need somebody who can see you more than your career, right? Somebody who can see you as a person, specifically in a high competitive environment like MBBS, and like I did it from a government college. I cannot comment on a private college of how competitive they are, but like a government college is very competitive. Even the professors expect you to know a lot of stuff, even though they might not teach you anything, but they expect you to know a lot of stuff. So at that point, I would say that having a good partner is very essential. But if again, I would say that if a partner is creating problems in your life, you don't need to have them just because you want to have a partner.
Okay, so do you think that emotional stability plays a bigger role in success than we admit?
Yes, sir. I think emotional stability is very important, because there are people who are very, very successful, and when you talk to them, you will realize that their life was genuinely very easy. I'm not saying that they didn't work hard enough or they were very lucky to get everything, but some people have an emotional stability which the other people do not have. Like I would say that a guy who's coming from a broken family, where either there is no mother or father, or the mother and father are divorced or everything, and their journey is not similar to a person who lives in a joint family. Everybody cares for them. But the thing is that they gave the same exam. So you must be thinking that, okay, this guy exceeded, but you don't know the where the other guy is coming from. So I have a friend who's not in my college in Chandigarh, but who did their MBBS from Delhi. So their parents were divorced when he was just 5 years old. So that, and then he had a very difficult life, and still he ended up landing in Maulana Azad in Delhi. So that is not an easy task. So I would say that having emotional stability or the emotional background where you feel supported, that is very important. But I think that is a thing you cannot control. So just focus on what you can control.
Okay, so during our MBBS life or during our internship, we went through so many different branches, and then suddenly we'll able to think that after completing our MBBS, we'll go with this branch. So same with you, that you love the surgery, your heart lay in medicinal branches, and these are the confusions many medicine people will have. So
Yes,
how
sir.
did you arrive at that clarity?
So, sir, that took me two things. First of all, choosing between surgery and medicine. So, the first, I would be very honest with you. Surgery has a very long learning curve. Like, just because you completed your MS surgery or your degree in even in the US, it doesn't mean that you're a good surgeon. You have to have a very long training period before you are confident enough to do things by yourself. So, I didn't want to go through that of a very long period of not knowing or not being capable of doing anything. But and the second part was that I wanted to have a long term relationship with with my patients. Like, what family medicine offers you is that a child starts visiting you when he's 12 years old, and then he can visit you till the age of 80 or 90. I mean, whenever till whatever they are alive, whatever age. So having that long term relationship was something that I felt more rewarding. And also, the when you come to the emergency aspect, the ability to handle emergencies, medical emergencies, that was more important for me than just working with my hands and not using my brain as often as I have to use in medicine. But again, being a surgeon is a very hard task as well. So yes.
Yeah. So internship seems to be where the emergency medicine acute care really attracted you. So
Yes,
what
sir.
about the emergency excites you emotionally?
Sir, there is, I mean, it's a very cliche thing, but there is an adrenaline involved when you see an emergency case because nobody knows what is happening. Even you don't know what is happening. But then when you try to solve it, it's like a puzzle or like a mystery where you have to delve yourself into it, and then you realize, okay, this is happening and that is happening. Then again, I would come to you with a surgical problem. Like, if somebody has a tumor in the pancreas, they know that, okay, there is a tumor and now you have to remove it. But uh, if a person presents in the emergency, you do not know why the symptoms are there. It can be due to 10 different causes. You have to get a lot of tests done, you have to rule out a lot of things, and then you come to one conclusion. So that is what made me fall in love with emergency medicine, that it is a very hard task and I get to challenge my brain much more than I need in a surgical branch. Again, I'm not demeaning surgery. I absolutely respect every surgeon, but that is what pushed me into family medicine and emergency medicine, because like in the US, family medicine and emergency medicine both are equally important and done in the same residency 3-year period.
Okay, now comes the big questions. Like so many people think about that key USMLE have a step one, step two, and then so many things you need to learn. And always the toppers only will have that courage to go with that flow because it will take so much time to clear them.
Yes,
Maybe
sir.
possible you'll clear the step one and then you'll struggle with the step two. So
Yes, sir.
you also said that you were scared of the USMLE and believe it was only for very intelligent people. So
Yes,
where
sir.
does that fear come from in Indian medical students?
Sir, I would first talk about my college here, like my medical school, which is GMC at Chandigarh. So that is a very amazing place for all competitive exams, including the USMLEs. Like, I would talk about NEET PG. So my batchmate, Dr. Vaibhav Garg, who's currently a PGI resident in internal medicine in Chandigarh, he had all India rank 1 in NEET PG. And then if you talk about the top scores in USMLEs, like the score in 270, I had my batchmates and my seniors as well as my juniors who scored in 270s in step 2. So my college is an amazing place. So get exposure to every competitive exam that exists, which is why I told you that I felt that maybe am I in the right place or can I balance that or not. But like 20% of my classmates or 20% of all classmates in every batch in the GMCH uh, are doing USMLE. So it is a very, very high exposure. But for a general Indian student, I have a friend from my Akash days when I was in Janakpuri, which is a small part in New Delhi. So he told me that, Bhai, I also want to do USMLE, but like there is nobody in my class or nobody in my college who has ever done it. Nobody knows what to study. Nobody, because like USMLE doesn't have coaching institutes. Like we have 3, 4 platforms these days for NEET PG. USMLE doesn't have that. So he was like, I don't know what to study, where to study from. YouTube pay, everything is very overwhelming. So one thing is this, that people are not having enough role models within their system. So somebody has to do it in their college, and I think it takes a lot of courage to do that. And the second part is the cost, which which is not affordable for everyone, which is again a privilege to be able to afford this exam.
Okay, so USMLE is expensive and you openly acknowledge the financial privilege involved.
Yes.
So
Sir.
how should a student think realistically about this pathway?
Sir, you would need a minimum of 20 lakhs to pursue USMLE, because it's not just about the exams. There are 3 exams and all of them cost about $1,000, which is like 1 lakh rupees. So 3 lakh ke to sirf exam hi hai, 3. So, uh, so this is it. And then you have to include the travel cost, the living cost in the US for 3, 4 months or 6 months maybe, and then cost of the cab, metros, and everything. So you need a minimum of 20 to 30 lakh rupees of an investment, and it's an investment. It's not going to go waste. But another thing is, which is a very hard thing for a lot of people, is that you have to dedicate 1 to 2 years after your internship. Even if you start with step 1 in the third year, you might need at least 1 more year after internship, or sometimes 2 more years after internship. And then you are going to see your batchmates become JRs. Even your juniors might become JRs. So you might think that कि यार मेरा तो कुछ नहीं हो रहा, मैं तो ऐसे ही बैठा हुआ हूँ. Even though you are doing something, but you still tend to see कि you are not doing or you are not earning at this age, and people are doing, even your juniors are doing. So you need to have that mental clarity first, that am I ready to spend 2 years? Because a lot of people have 20 lakhs in India. 20 lakhs is not such a big amount that it's only for the top 1%. But a lot of people do not have the courage or the patience to go through 2 or 3 years or maybe 1 year, which is required. So having that courage is also important. And as I say, time is money. So you need to have the courage to spend time.
Okay, and one more question regarding this. Like, I've heard that not just your preparation in USMLE needs for clearing the exam. You need to have so much of what we call it as a clerkship in. You have to do some clerkship over there in US, or you have to publish your some paper and all. So what about this? If someone is listening you, so what will be the basic thing you should have when you're going to start your preparation?
So, sir, there are 3 exams first of all to get ECFMG certified, which is USMLE Step 1, Step 2, and OET, which is the English occupational English test, which is for doctors. So after that, you become ECFMG certified. But like NEET PG is a very clear thing. I'm talking only about the open category right now. So you get a rank, and then you choose a college, you choose a branch, and something like that. That's it. So suppose if I wanted surgery, but my rank is much better, then I can take medicine. And suppose if I wanted surgery and my rank is now bad, I can choose a non-clinical branch as well. But like here, you have to build your resume towards 1 or 2 subjects. That's it. So you start early, and then you have to build your resume tailor-made to that very specific subject. Like getting surgical branches is very, very hard in the US. So if you if you score very high, and then you suppose, for example, you are doing your rotations in surgical branches in the US, and then you end up scoring low, and now you cannot apply for surgery because surgery is only for high scorers most of the times. So now you cannot apply in medicine just because your score was less, because your rotations are for surgery. You have to build your CV in that specific subject or maybe 2 subjects, not more than that. So you build your CV in that specialty, then you have to do some sort of research work. You don't need to be a Harvard level, PhD level researcher, but maybe 3 or 4 publications like a case report, a meta analysis, or systematic reviews, and sometimes a narrative review or a case series. These things are going to help. And I was able to find a lot of people who helped me research through Reddit. So you just put a question on Reddit and you ask for help. So a lot of people are going to ask you for money, but there are some people who are going to teach you for free as well. So I took the help of a guy who charged me just $50, and $50 is not a lot of amount. It's just 5,000 rupees. So he charged me $50 to actually teach me on how to do research. So even though I did not fully learn in that in his 3 hour course, but then he was kind enough to give me further courses even for free, because like he realized that okay, I'm from India and like the conversion rate is very high. I use ISD to USD. So you need to find the right people, and trust me, you can find a lot of good people on the internet. It's not just because somebody is a stranger, he or she may not help you or may not be able to help you. So one thing is that, and then there are a lot of resources on the YouTube. And then I talked about research, I talked about rotations and scores. And then another aspect is volunteering. You have to volunteer, and it's not just any volunteering. You have to volunteer related to medicine. Like I cannot say that I volunteered for a car company. That's not going to cut it. So like you can volunteer at different shelters, at NGOs, or run health camps to build your CV. Like I did. So I'm from Delhi originally, but like my grandparents are from Hisar in Haryana. So I went to Hisar and I worked as a medical officer for 1 year there. It was just part time. It was just 4 hours on Saturday, Sunday, and Monday to Friday I was studying. But then I also volunteered at a nearby health clinic, which was run by an NGO, where I actually did everything for free. And because I'm just an MBBS level, so I could not even do much things. But I used to measure the BP, I used to check the glucose, and used to prescribe medications for diabetes and medications for hypertension. Very bread and butter basic things. But you need to do a lot of things other than the exam. And exam is not only going to cut it. Unless you have a very big connection in the program where you're going to apply, or you have stellar scores like 270s, majority of the people need a lot of things to do.
Okay, so after completing your MBBS, let's take an example. After internship, you also have given the NEET PG exam and you got 20,000 rank with just 1 month of prep. So
Yes,
what
sir.
was that moment ki disappointment or hope?
So initially I was disappointed. I did not talk to anyone for 3 or 4 days because I thought that maybe if I score a rank of 10,000, I would be able to get into psychiatry in my college in Chandigarh, because I had very small dreams until then. My dream was to just stay in Chandigarh, because Chandigarh is a very amazing city. I have lived in a lot of places in India, and I would say that Chandigarh is the best city in India to live. However, because there was initial disappointment, but then I talked to my father and my friends who were able to convince me for a drop year. And then I was like that if I have to give 1 year, why shouldn't I give 1 year to things that I actually want to do, and not go into the rat race of NEET PG? Which is, I understand there are a lot of people who want to genuinely stay in India, and that's their choice. But I wanted something else from my life, and I did Dr. Zainab Vora ma'am's BTR, which is Buri Tarah Rato. So that was a comprehensive course which I was able to do in 1 month. So I realized that I know a lot of things. I can use BTR and I can use first aid, and let's see if I give step one. If step one happens, happens. If it doesn't happen, okay, I will prepare for NEET PG again. And then I just took 4 months for step one because my base was very strong from BTR, and then I was able to clear step one in first attempt in just 4 months, and then I set my dreams on a higher thing, and so that's how it started.
So you mentioned Spark. Maybe I can do something if I'll try. So how
Yes,
important is that one honest attempt?
sir. When you talk about Spark, I this is something which I have had an opinion on since a very long time, that fire is the greatest invention of mankind, not the technology and not the other things. So fire is the greatest invention, and every fire starts with a spark. So if you have that spark, and you need somebody else to identify that spark, you cannot identify the spark in yourself. So you need to have people who can motivate you and who can initially give you the push. Okay, discipline is very important, but things don't start with discipline. Things starts with the motivation. So having that spark is very important to give you the push, and then you turn that into a fire when you are disciplined enough.
Okay, so let's talk about your USMLE thing. Starting USMLE 4 months after your internship is considered late. So
Yeah,
what
according
made
to
made
Indian
you?
standards.
Yeah. So what made you take that risk anyway?
Sir, because I wanted to take a chance on my dreams. So I came across an Instagram reel where a lady was starting her business for the first time at the age of 45. So that reel came to me 2 days after NEET PG results. You know how Insta algorithm works. Whatever you're thinking, it pushes you to that. So, so a lady was 45 years old. She quit her job and she started her business. So the lady told that she wanted to always run a business, but she was very, very scared of what if the business doesn't work out. And then she says that she's 45 now. So if she had started her business at 25, after she was done with her master's, maybe she would have built a successful business by the age of 35, and now at 45 she would have been a very, very top CEO, or maybe the very, very big position in that business or that company. So I thought that I'm just 24 right now, and I will turn 25, and if I match into residency I would be 26 or 27. So I think I'm going to turn 26 or 27 anyways, even if I stay in Chandigarh or even if I stay in Delhi. So I can celebrate my 26th or 27th birthday in the US as well if I try. And if it doesn't happen, I can always come back to India. I have a house in India. I can always return from where I came from, but you cannot always go to a different place. So that is what made me this brave, this simple Instagram reel, that you can always start, even if it's late.
Okay, so clearing step one and step two within 1 year is huge. So
Yes,
what
sir.
kept you going on days when self-doubt returned?
Sir, actually, it was a very hard thing. Once I was done with step one, clearing step one was a very, very, I would say, and a fun task for me. I never took step one seriously. I just wanted it. I wanted to get done with it, and I knew that I have read enough BTR from my NEET PG days that I can get done with step one. So that was a fun thing for me. But once I passed step one, I was like, यार अब तो करना ही पड़ेगा. अब तो पास हो गए, अब तो करना ही पड़ेगा. So then I started to self doubt that should I do it or not. I had a lot of doubts before 2 months before my step two, that should I even give step two or not. I don't think I can live a comfortable life in India. I have enough resources in India, so why should I go into a struggling life? I mean, life in the US is 10 times better, but initially for the first few years, it is very, very hard and very struggling. So, and when you see that with an Indian person who has like access to everything, house help and everyone, so you also think about that stuff, that you have to do everything alone here. So that was a very, very hard decision for me, and also leaving behind my friends and family. So of course they're not left behind, but obviously you do not get to meet them as often as you would in India. So that was a very hard thing for me, but I always convinced myself that I have pushed myself into this. Nobody has forced me, and nobody will force me if I decide to not give step two. But I should continue. And then I had this thing in my mind that, okay, I'm already 4 months late. I do not want to get more late just because I wanted to take a break. So I gave step one, and before the step one results came out, like the results take 2 weeks to come, I was done with my English exam, which is the OET. So even in those break, I watched a web series in the morning and studied in the evening, and at the night I used to go to the gym. And I gave step two also in 6 months. So I shifted to Canada because my father lives in Canada. So completely to Canada because I decided that if I stay in India, I'm going to try to meet people who are doing something already. So like my friends are residents, and I would want to meet my friends, but at the same time they are residents. I am nobody right now, so I should focus on myself for a few years. And then I came to Canada, and then I studied hard. So it was very hard in the beginning, but then I was always saying, or I was always backing myself that I can do it, I can do it. I don't know if it actually worked or not, but I backed myself a lot, like sports people do.
Okay, so you have spoken about the blessings and friends and consistency. So, but also feeling not capable.
Yes,
So,
sir.
how do you study when you don't fully believe in yourself?
Sir, I think feeling capable is a feeling and it's not a fact. So meditation is very important to separate yourself from your feelings. So I also meditate. I'm not a very, very big meditator, but like I try to get in 10 minutes of meditation a day. So when you do meditation, you realize that your thoughts, your feelings, they are not you. So at the same time, not feeling capable is also a feeling which is not you. You have to separate it from yourself. And not knowing things is a very, very normal thing. I am very in touch with human body, but I do not know anything about tax. I do not know anything about engineering. I do not know anything about law. So if I push myself into that, it would be a very hard time for me initially. It doesn't mean that I'm not capable. It just means that I do not know enough and I can work on it. So it's the same with medicine. Just because you have done MBBS or you've done MD or you're doing MD doesn't mean that you are a full-fledged doctor. There are people, we say that this doctor has been practicing for 30 years. What does it mean? That you are practicing, you're still practicing. Practice is done by somebody who's learning. So you are a practicing physician. So this means that the process of learning is always on. So you have to know that feelings are not facts, and your actions are. So just do the actions which are going to translate into confidence.
But nowadays, when we talk about the medical community, so many people suffers from the anxiety, depression, and all due to their exam pressure, peer pressure, or the toxicity in the residency. So you also have dealt with the anxiety during the tough phases. So how did you recognize it? The first and most important question: how did you recognize it, and then how did you manage with it?
Okay, so the first part was that when I was getting overwhelmed by the fact that okay, everybody is exceeding in life or excelling in life except me, and while that's not true, you just think that only you are behind and everybody else is ahead. But that is a very common feeling again in medicos. Medicos always have this feeling of FOMO, which is fear of missing out. So it's just because no matter what you do, somebody is always going to be better than you. Like you are an MD medicine, somebody is going to be a cardiologist. You are a cardiologist, somebody is going to do interventional cardiology. You are an interventional cardiologist, somebody is going to be a cardiac surgeon. And if you are a cardiac surgeon, then somebody would have done IS and now they're in the ministry and now they have so much power. So people are always going to be ahead of you. And having that gives you anxiety initially because you think that, okay, maybe I'm not capable enough or I'm not talented enough to be what they are. But then you have to realize that I realized this myself regarding this fact that I'm not enjoying the process anymore rather than I'm just trying to avoid failure. Because, like, when I was giving a test or I was giving an exam or I was actually studying, I was not studying for the fact that I want to excel. I was studying for the fact that I do not want to fail. So I know that a lot of people say that not wanting to fail is also an important thing. Like Shah Rukh Khan also says that he acts because he's afraid of failure. But I again feel the fact that if you're not enjoying something, then there has to be something has to be changed, either inside you or outside you. So I know that outside was medicine and I love medicine. So something was inside which has to be changed. So what needed to be changed was the way I talk to myself. So I had a lot of negative self-talk around me that okay, yaar, you are not good enough, you are bad, or you do not look good enough, you do not have a good physique and everything. So I know everybody has negative self-talks, but not everybody is very open to talk about it. I recognize that, and then I talk to my parents. I talk to my best friends, my girlfriend, and I also got a dog at that time simply because I wanted to feel nice, and that dog is very important to me. And so combination of a lot of things helped me push through that phase.
Okay, so you choose family medicine, okay, and a lot of people have a confusion regarding that what actually this branch is. So,
Okay.
what made you fall in love with this branch?
So the biggest thing for me in family medicine was that the work-life balance it offers. So, like in the US, the family or US or I would say even Canada, the family medicine guys only work 4 days a week or 5 days a week. And like if you work 4 days a week, you have to work 12 hours, and then so you work 48 hours, and the next 3 days are off. And if you work 5 days, you work 10 days, 10 hours, you work 50 hours, and then again 2 days are off. So I was more interested into 4 plus 3. So you work for because if you're working 10, rather just work 12 so that you have a complete off on another day. And one is this, and then family medicine also offers you to become a hospitalist. In the US or Canada, how it works is that you 1 week on and 1 week off. So you work 12 hours a day for 7 days, and then the next 7 days are completely off. You do not have to go to the hospital. You do not have to pick up a phone call. So it's very sad that it's not still there in India, but I hope someday it will be. So having that work-life balance and also knowing that I love to see patients because like I am somebody who aligns more with knowledge than skills in the hands. Like a surgeon has to have a very high amount of skills in their hands. Nobody can become a good surgeon unless they have a very good hand-eye coordination. So they have to realize that. So I realized that maybe I'm not going to be very, very capable as a surgeon, but I can be very capable as a medicinal person who has to think more and come to the diagnosis. So, and then family medicine also gives you the incentive to go into the outpatient practice, which is simply the OPD practice. You can see emergency medicine. In family medicine, you're also able to do basic obstetrics and gynecology like vaginal deliveries and episiotomies and those things. Not cesarean. You can get trained in cesarean if you want to, but basic vaginal deliveries and antenatal care is everything that somebody should know. And also being able to see some pediatric cases, some neonatal cases. So family medicine is what is a complete doctor. Like you see the patient from the first day of life to the last day of the life. So that is what family medicine offers. And having that sort of capability in me, or having that sort of magical knowledge, which I call magic because it's a magic. So having that is very important to me. So that is why family medicine.
So many people have doubt and confusion regarding which branch to choose and which branch that didn't suit them. So how important is knowing what you don't want?
Yes, you said it very right. You might not know what you want, but you should at least know what you don't want, so that you're able to rule things out on what you don't want. So, as I said, that I knew that what I wanted, so that is okay. But you should at least know what you don't want, so that you know that okay, so these branches are striked off, and now I can focus on these things. And then you do an internship, and you also during your clinical posting, specifically in the final year, you realize that what you want to do. If that is not enough, you always have some doctor that you know, right? Everybody knows at least one doctor in their life in India or anywhere. So, and that doctor is going to know a lot of doctors. So that doctor is going to introduce you to people who are in different specialties. Suppose somebody wants to become an ophthalmologist and somebody is confused about it. So even if they do not personally know an ophthalmologist, they might know an internal medicine person. That internal medicine person will have a batchmate who is an ophthalmologist. So you talk to him or her that sir or ma'am, I want this. And what is your life like? What are your challenges? So they will be very honest with you. Nobody who is a consultant or a resident is going to lie to an aspiring student. So you learn from them and you talk to multiple people, not just one person, because one person has a subjective experience. So if you want to see it objectively, you have to ask multiple people of the same specialty. So once you ask them, then you realize that do you want a life of them or do you see yourself in their life? And if the answer is yes, despite the challenges, then you go for it because challenges are going to be in every branch. Medicine is something that every branch is going to be problematic and has its own set of challenges.
So, from what you have seen in abroad, like low toxicity, ethical practice, infrastructure, and the reservation system, so what differences stood to you the most?
Sir, the two differences, the most, three actually. Three are the biggest differences. First is the infrastructure. The infrastructure, even in a government college, is very high simply because there is not much corruption. Corruption is not eliminated in any country. Every country has corrupt people. But like at least in the government setup in the US, the infrastructure is very top tier, and you can have the most advanced machines which are only seen in top private colleges in or top private hospitals in India. You can see that in a government setup as well. And having that thing, and the second thing was toxicity, because like in India there is a hierarchical system that you are junior to me, you are senior to me, so you will be treated like this, you will be treated like that. Here there are third year students and attendings which are consultants. So the consultants are bringing coffee for a third year student. Consultants are taking third year students in their car to have a ride around the city and to have lunch and inviting them on lunch and dinners. So you do not see that in India. Like at least in my hospital, I didn't have any connections. So no consultant actually treated a third year student like a colleague. They didn't treat it that way, and it's not their fault. It's the system which has brought them to or has made them like this. So that system needs to be changed. But I'm very hopeful that the people of my generation who are coming up, or even one generation above me, like 5 years above me, they are not going to be as toxic. It's the old people who are toxic right now. Most likely, I think in the next 20 to 30 years, when people of my age are there in Indian hospitals and colleges, then I think the toxicity would be less. But I don't think we should wait for 20, 30 years to make an impact when we can do it right now.
So you want to help and inspire other Indian medical graduates. So why does giving back matter to you now?
So giving back matters to me because I know that if I had someone like me as a mentor, it would have helped me a lot. Because I do not judge people based off their vulnerabilities or their challenges. So of course it's not like that I'm a perfect person, but I know that having a mentor is very important, specifically somebody who actually has been in your place. It's just a saying that you can be the most knowledgeable person who has read like thousand and thousand books on tennis, but they have never played tennis. So it's better to actually ask a person who doesn't even know how to read, but he's been playing tennis for 10 years. So it's better to ask him about how to play tennis than a guy who has read thousand books on tennis but never stepped on the court. So I think I'm going through a journey. I'm still in the journey. I'm nowhere where I want to finish, but I'm also not where I started. So if people actually come to me right now, maybe I can help them, and maybe I can guide them to better place. And that this simply matters to me because I know how it feels to not having any help. So it would give me more happiness than it would give them. So that is the thing.
So how you got to know about the Salaah Shots?
Sir, I got to know it through my senior. So my senior, Dr. Anisha Galotra, who matched into radiology in my college. So she was the one who was first approached, and Dr. Noble, who's again doing radiology. So that's how I came to know about it. And then ma'am reached out to me, and then I talked to her, and then it was a nice bonding. She understood what I am trying to give back, and of course the goals aligned. So that's how it happened.
Okay, so what are your views on this Salaah Shots when you heard and know about this platform? So what's your views on that, and what will be your advice to the people who are listening to you?
So my views are that it's an excellent platform because it's not easy for everybody to reach out to everybody. Like somebody is doing US, somebody is doing INI, somebody is NEET PG, AMC, USMLE, everything, even England. So you guys have different type of people who have completed their journey or still are in their journey. So this makes sense because there's a single platform which can allow you to navigate what your goals are. Like I am doing USMLE, I do not need to listen to what a guy of Indian or Australian or England guy says, or same goes for the other people. So this is very important that there is a one platform which consolidates and makes it concise for every aspirant of different exams.
Okay, so what does making a meaningful difference mean to you as a doctor today?
Sir, first is for my first goal is towards, of course, my patients. So I want to help a lot of people. I would not shy away from the fact that I want to be very rich. I'm not saying that I just want to do noble service and nothing else in return. Having money is very, very important. But I want to make people feel loved, even from a doctor's point of view, because I have seen a lot of doctors that they just treat the patient as a patient and they do not give them enough respect that they deserve, or they do not treat them like a human. So treating the person as a human is a very important thing for me because I have myself been treated like a patient, and then when that guy came to know that I'm doing MBBS, he suddenly changed, and then he suddenly became a very nice person. So I do not want to be the person whose behavior depends on what the other person's qualifications are. So that is very important thing for me, and at that moment I realized that I do not want to be like him. So yes.
So now we'll start our rapid fire round in which you have to tell the answers in one line. So we'll
Okay,
start
sir.
with that. The biggest myth about the USMLE is
That it can only be done by the intelligent people.
the moment I doubted myself the most was
When I scored a rank of 20K in NEET PG.
family medicine gives me something other branches couldn't.
The ability to do long-term care, see patients, and still have a work-life balance.
So taking risks taught me
That you can always succeed, but you need to have the courage. Otherwise, you will always wonder what if.
the best support system in my journey was.
My best friends and my girlfriend and my parents.
If I could talk to my 2018 self,
I would just say that you are going to achieve a lot of things. Do not worry much, and hopefully things will always work out in your favor, even if you feel that they might not.
Success for me now was
Helping other people achieve success, and also myself uh, keep seeing patients and earning good money.
okay. Then your journey reminds us that the medicine is not just about the intelligence or timing. It's about the self-awareness, courage, and choosing a path that fits your values. Starting late didn't make this journey weaker. Self-doubt didn't make it less valid. And choosing alignment over the glamour didn't make it smaller. If you
Yes,
are
sir.
listening and questioning your abilities, your choices, and your direction, remember that the growth often begins the moment you stop trying to prove something to others and start being honest with yourself. So, thank you for being a part of this conversation. This is
Yes, sir.
Salaah Shots, where the real stories say better doctors. So, thank
And
you
sir,
so much.
I would like to end with this, that the door is always open for those who dare to knock.